Biliyor musun? Erken rezervasyon başladı. Yazın en renkli fırsatları cyprusparadise.com'da. %40, %50 hatta %60'a varan kaçırılmaz indirimler. Erken rezervasyon yap, uçak bileti fiyatına paket tatili al. Uygun fiyata Kıbrıs tatilinin adresi cyprusparadise.com. Zaman akıp gitmeden acele edin. Bir bakmışsınız yaz gelmiş. Cyprus Paradise. Tatiliniz bizimle güvende.
Kalitenin, güvenin, hızlı teslimatın adresi Ancon Furniture. Ancon Furniture ailesi olarak yeni ürünler ile hizmete devam etmekteyiz. Yeni model koltuk takımlarımız, yatak mekanizmaları bir dokunuş ile açılıp bir dokunuş ile kapanabilmektedir. Bir dokunuş ile açtığımız yatak mekanizmasının yatak çarşafı kullanıma hazır, serili olarak içinden çıkmaktadır. Yıl sonuna kadar herhangi bir koltuk takımı alan her müşterimize akıllı sehpa hediyemizdir. En iyi ürün, en iyi fiyat. Sadece Ancon Furniture'da. Bize uğramadan karar vermeyin. En iyisini biz yapana kadar daha iyisi yok.
Welcome to the latest printed press. I'm Aysen Jemal, and tonight we're going to be giving you updates on the latest on COVID-19. We're actually going to be talking about the health services available and some up and coming projects to do with that. I'm very happy to have Mike Wilson, Director of Public Voice and Healthwatch from Haringey, Jansev Jemal, Senior Research Manager, and Erim Metto, the CEO of the TCCA. Welcome everybody to the programme.
Thank you. Hi, right.
Yes, you're very welcome. Thank you very much for coming on and giving us the latest updates, really. I think everybody is really waiting for it. So thank you very much. Hopefully you've had a good day. We were just talking backstage, weren't we, about how it feels. Some of us are actually going into the office, some of us are not. So it's all sort of quite different for everybody. But I think everybody obviously wants to get back to normal. But obviously there are restrictions currently. We are currently in a lockdown across the country. But like we were discussing, there is a glimmer of hope as well. I'd like to start with Erim first of all. Can you cover what's happening and tell us what we launched last Friday?
Yeah, so as we know that we as an organisation have been dealing with COVID ever since March of this year. So when it first started, Jansev has been amazing. You've been amazing. So we've all worked together in partnership to deliver services, mainly been volunteer based. However, what we did is over the summer months, you know, from period of June right away through to August, we made applications to create a foundation for the projects we wanted to provide. So we made applications that would allow us to have specialist offices in various areas, that would allow us to coordinate activities and organisation we wanted to do, and also to be more reactive, to be able to action changes almost immediately as they happen. So from our perspective is last week we decided to launch based on what we wanted to deliver. the main things that we launched was that we launched a project that we was going to be delivering food runs to the local community. So the food runs that we was doing before were based on volunteers. Now we've actually got funding to deliver dedicated projects within Enfield and Haringey for food runs and essential items. Secondly, we launched a befriending. So we extended the befriending we had previously, but it's more coordinated now. So befrienders are contacted on a regular basis. We advertise for new befrienders. We make sure that people who are being befriended do have regular contact with a professional officer who can check that their well-being is being dealt with by the befriending project. We also launched a counselling project, which will be pre-booked. So if people need counselling or help, we have a bilingual counsellor who will be able to tap into. Gulai, who runs Eurogench, has got the position of communications officer, so responsible for communicating any change that happen almost immediately and using a myriad of forums that we could use to be able to do that. One of those forums is obviously WhatsApp, is Eurogench TV, is social media, and we're launching a dedicated website which will be borough associated. So one section of it will be dedicated to, for example, Haringey Council and look at what services they're providing and what area specific services are, looking at other mechanisms that we are to be able to communicate with the community. We also have a number of projects that we are which are simmering, so we're waiting to hear final decisions on those projects. One of those is, for example, we have a COVID business project, which what we want to do is to work with businesses to make them COVID compliant. So a certificate based on compliancy of what they do, similar to a food hygiene certificate that organisations get, but this will be to look at, do you have the right things in place? Obviously, we wait for the grant to be agreed, but we won't be able to start now because most businesses are not operational. So once businesses are released to be operational, then that might be able to be kicked in to support them. I mean, finally, what we're doing is we've also got another project, again being funded by Hackney, which the funding hasn't been released for yet, that looks at COVID champions. So train people in the community who do have major links with other people in the community, like carers, this, that, the other, and to allow them to spread the message of what is COVID compliant and what is well-being and what you should be doing. So it's members within the community who interact with the community who be able to deliver the message that we want to get across. So that's where we're at. We launched it last week on Friday. This week is lots of prep work, and next week we fully kick in with all the services.
It's fantastic. I mean, a lot of things there are very useful. And I think it's such a shame because businesses did really make an effort after the original lockdown, obviously, and made lots of changes. And it's quite heartbreaking that obviously businesses are having to shut, and they're going to need that new support when they reopen. So I think that's really, really good. But having said, we've got, like you said, funding for some of these projects. We've got experts in, but we also do have all the volunteering that will all happen. That's all going on Fridays.
I mean, like for example, previously what we'd do is we'll do one key date on a Friday for food runs and essentials. That was happening every Friday on the clock. We was doing anything between 60 to 150 homes.
Yes.
What we decided to do this time round is, because we have dedicated funding from 2 boroughs for deliveries, those 2 boroughs will be done on different days, which is a Wednesday and a Thursday, or no other associated areas will be done by volunteers or completed by volunteers on a Friday. So we're going to relaunch that. Or we've been speaking to our volunteers, and people have been saying which areas they can cover. The other thing we're doing now is that before we was actually anyone who was in need, who's presented in need, would be provided with a service. Now we're doing an assessment on need as well. So some people do need the service, some people don't need the service, and some people need service plus additional bits to that service. So because we've got paid staff, we can needs assess, and the staff are appropriately qualified to do that. So the changes are positive. It's a very negative environment, but we're trying to make the best of it and trying to utilize skill sets to the best we can. I mean, today Haringey Healthwatch agreed a fund to support communication to the community. We was having a discussion about that. So that's going to provide greater information on what should be done and what services are available, how we should be conducting ourselves, and being able to not take misleading information on board, but have accurate information that's done by the professionals that safeguards us as a community.
Yeah, I think that's extremely important so that we are, you know, providing everybody with the correct information. Mike, welcome again. Thank you very much for coming on my program. I know you've had a very busy day, and I know you met up with Erim as well earlier. So thank you very much for taking time out of your schedule to, lend us your expertise. Can you tell us first of all what Healthwatch is about and how it is supporting work in relation to COVID?
Right, yeah, well, thank you very much for inviting me. Healthwatch is a statutory organisation, so every local authority has a Healthwatch. We are Healthwatch Haringey. We basically are the voice of health and social care users, so we represent their interests. Anybody who uses NHS or private health, social care users can come to us for information, advice. We pick up complaints if they've got complaints. And we're usually, not now unfortunately, we're usually out in the community meeting people to find out what their issues are. We've got very good relationships with the hospitals, with the GPs. So when we do pick up issues that need addressing, we can go to the GPs, the hospitals, the council and say, you know, these things are issues that you really need to address. So we're pretty busy. Our activity is very different now because, as I say, normally we're out and about, but we're not out and about in hospitals with our stalls and doing outreach work in shopping centres now because we're not able to. So most of our work's now on the internet. We've got 9 people working in GP surgeries who are called social prescribers, who basically signpost patients to activities and to other organisations and other services, and will perhaps link in with the work that Erim's doing as well. So our social prescribers are a range of nationalities, got a range of language skills. So we're out in the community all the time. In response to COVID, we've recruited 400 volunteers. We had 70 at the beginning. We now got 400, and we've got about 250 volunteers. They're doing things like phoning up vulnerable adults, usually older people, but not necessarily. So they phone, we call them telephone friends. So they'll phone them once or twice a week for half an hour, make sure they're okay, keep in touch with them. So that's a very new project, but it's one that we're going to carry on with. We're just in the process of developing something called telephone circles, which is getting maybe 6 people together on a conference friendship telephone call so they can talk to each other. So we're just launching that. That's sort of, you know, the new thing for lockdown 2, if you like.
Yes.
And we were very, very busy in lockdown 1 delivering medication to people. So picking up medication from pharmacies and then delivering it to the people who couldn't get out. They were shielding. About 10,000 in Haringey were shielding. So we got about 700 clients, nearly 800 actually, on our database for medication delivery. So we've had to respond in very different ways. And all our meetings now with service users, our focus groups, are on the internet. So we're becoming more adept at using Zoom and Teams and all these other things.
It's amazing, isn't it, how we have adapted
Yeah.
community, you know, and it's great. I mean, you're doing so many wonderful things. I mean, the big question is what's happening with the vaccine. I think maybe I'll bring Jansev into this one now. You know, that's the big question out there at the moment. We had that announcement from Boris Johnson a few days ago, and obviously, you know, other news thereon about the vaccine. What do we think about it?
So early signs are very, very positive in terms of the testing with this particular vaccine that's come out of Pfizer and BioNTech. I think obviously it's still sort of early days. So in terms of whilst the trial seems to have gone very well, the next steps would be to get the vaccine authorised through bodies like the European Medicines Agency. So we're probably looking at early next year rather than actually getting it through ahead of Christmas. And when the vaccine does come, obviously I think there was a government announcement recently where I think they've committed to buying up a certain amount of vaccinations, and there will have to be sort of a prioritisation and focusing on sort of, you know, medical staff, older people in the first instance before it sort of filters down. So it's looking very promising. as I said, it's, you know, and the other thing I think we also need to remember is that, like with all of these things, there will be a lag effect. So from the point at which the vaccination starts to hit on the ground, you know, it'll take a while before we start to sort of see the positive effects of vaccination. You know, I think we might come on to talk about this later on, but in the meantime, obviously we've got the current restrictions in place, and I think there's a question mark about sort of once this lockdown period is over, and how we sort of move forward from here, and sort of how we sort of, you know, in terms of life and what politically might happen. I don't see the current lockdown being extended further, but what is likely to happen is going back into sort of one of the tiering levels, whether that's 3 or 2, as London was in before. So yeah,
that's still a positive. We've actually got a very good question. We've got lots of claps and lots of support from our audience, but Gunil has said, who will get the vaccination first? I think that's quite a key question.
I think it'll be, and Mike might correct me if I'm wrong on this, I think it's going to be sort of key NHS staff, and then elderly people in social care homes, and so on.
Yeah. Oh, yeah. Michaela's actually just put NHS staff will be first. She's saying will be vaccinated first. Thank you. I mean, she's a pool of knowledge, that lady. Thank you very much. Week commencing the 2nd of the 12th. So it's all good. There's also a really great story to how this vaccination came about. Who told me that story? Was it you, Jansev, or was it Mike? Before the program, about the couple.
Yeah. So in terms of BioNTech is headed up by a now husband and wife team, Shahin and Özlem Tureci, and yeah, I believe they recently got married, but their own colleagues have been saying how passionate they've been about sort of working on trying to help find a vaccination for this. And the story goes is that they were back in the labs on the day that they got married, sort of working to help pull the, you know, the vaccine together.
I can understand that though. I can appreciate.
I've got a question as well. In the whole mechanism of the vaccine and the vaccine becoming available, as far as I know, we're in the latter stages of research for this vaccine, and there's other vaccines which are available, and there's rumours that it's not only going to be one vaccine that's going to be used, it's going to be a number of vaccines that are going to be used in joint coherence and so forth. So my first question is, where are we on the back? Are we in the final stages of the research into the vaccine being completed, and are we final stages of trials, or where do we fall in the whole equation of things, and how are the other vaccines doing in comparison to this vaccine in being, where are they in effect in their whole life cycle of being released?
So Mike, I don't know if you want to come in terms of so I believe that the BioNTech Pfizer vaccine is the most advanced, and the fact that it's now close to going through that sort of authorization process, you know, tells us that it is the furthest along the line. It's currently at stage 4 in the process.
Yeah. Yeah, Kella's just put in a comment. She's put, it's true that you have to have a follow-up injection a few weeks later. And you're absolutely right, Jansev. She's also in agreement, saying that it's stage 4 in progress. So yeah, she's put, true. That's your mum, isn't it? That you have to get a few weeks later. Thank you very much for watching. Yes, so it's all hopeful, isn't it? I mean, Michaela's also put Parliament passed an act to negotiate a faster process for 2 years maximum, because obviously normally, I mean, I remember when she came on our program, she said it can take up to 10 years, but obviously it's speeded up due to the urgency of the situation. Mike, what can we expect to change over the next few weeks, and how will services change according to that?
Well, I think over the next few weeks to the beginning of December, we're going to be still in the lockdown. Most shops will be shut. A number of people will be staying at home because they're scared to come out. I mean, the government guidelines on leaving your home are quite grey now. They're not really black and white. So if you want to go to work, they say only go to work if you can't work from home. but that's up to you to decide whether you can work from home or not. So it's fairly grey. There's no shielding in terms of government aren't providing food parcels to people, but there are thousands and thousands of people in Haringey alone who are scared to come out. So in a sense, they will be still shielding. So the mutual aid groups that you probably know about in the various neighbourhoods, street-based groups, they'll still provide support. They'll do shopping for people. We'll carry on doing the medication. We'll carry on phoning people, make sure they're okay. So I think it'll be very much like it was a couple of months ago. And hopefully people will take it seriously, because it's our one chance really to win a bit of time, which is really what it's all about. Then on the 2nd of December, we'll find out what's going to happen. And hopefully it'll be, as Jansev said, some step back to maybe tier 2 if we're lucky, or if not tier 3. So I think the next 2 or 3 weeks are going to be, ones we're just going to have to bear with, and hopefully just everybody will, stick with it, and that will be the benefit of them and everybody else.
I know, yeah. Mental health, like I said, it is being effective, obviously, but we've just got to try and remain positive. Jansev, the question next is longer term. Will we have to learn to deal with the virus?
I think we will. It's, I was thinking and I was reflecting over the last month or two. I personally know more people that have tested positive for the virus than initially going back to sort of March, April, when we first went into lockdown. But I'm also taking heart from the fact that people are generally recovering from it. Now, some people, in terms of how COVID is affecting them, varies from individual to individual. Some people are having more severe symptoms. They tend to be, I think, older people, more vulnerable people. But otherwise, people are generally recovering. And I think the other thing we need to factor in is that the doctors they've been learning all the time. So since, we went into lockdown in March, and they've been dealing with COVID patients, they are more advanced in terms of their knowledge about how this virus behaves and what it will respond to. So I think there are lots of reasons to be positive and hopeful. In terms of lockdown and what happens on December the 2nd, as I said, I don't see lockdown continuing. I think partly, if in all honesty, for political reasons. Sorry. I think, to be honest, I think partly for political reasons. I think Boris Johnson will actually struggle to get a vote through Parliament to extend the current sort of lockdown. So as long as, now the only caveat I will add to that is, as long as this lockdown period is shown to be effective, in that we see those numbers coming down. I mean, the figures this week, make for bleak reading. We hit 50,000, we've lost 50,000 people. And we've lost more than any other country in Europe. And in the last 24 hours, we had the highest number of people testing positive. Now, that will partly be down to the fact that there is more testing going on than ever. We needed that to happen. And as you may be aware, in places like Liverpool, they've gone with mass testing in order to try and sort of contain the infection rate. So we were always expecting to see sort of, those spikes in terms of testing positive go up. But like I said, there are reasons to be positive in terms of living with the virus. And I think also, to pick up on your point about mental health, I think for lots of reasons, we have to reach the point where the virus isn't going away anytime soon. So we have to sort of try and establish the right balance and normality for people, which means that people are sort of behaving sensibly, taking the necessary precautions, particularly if they're feeling unwell, but can also continue to lead as sort of normal a life as possible.
Yeah, I mean, I think that's the comments that we're having coming through. People saying that already we are starting to live with the virus, and it's, using your common sense and, protecting yourself, your loved ones, and other members of the public when you're out and about, really, and in the workplace. Halil Shefket has said, another insightful program for the community. Thank you all for taking part in this episode. Yeah, and I'd like to thank you all also. We're in our last 5 minutes now. Time flies by very, very quickly. And Michaela's actually put 3 weeks. So in 3 weeks' time, things should start to develop with the vaccines. Fingers crossed. I mean, Erim, if we just quickly move on to who we plan to bring onto the program next in the future, in the next couple of weeks.
I mean, I want to say a few other words. I mean, there's a few things which have been picked up by people in this group, and also people who've commented, and things around mental health and how things are going to change. I think one of the biggest challenges for us as community leaders and obviously people involved in the third sector is to have the foresight of what's going to happen in 6 months' time and plan for that. We can see that the cases of mental health illness are rising quite sharply, and people around us are finding it very difficult to adjust to how we're living our lives, especially young people in our community. And we need to think about what do we need to put in place to try and provide that support. That needs to be provided with diminishing funds available to do that, and it's looking at what collaborative work can be completed that resources are most maximised in being able to deal with the issues. Fortunately, I think one of the biggest things that's happened over this period of time is that we've had quite innovative people who have resourced platforms that allow for things to happen. Like, for example, Halil, who's commented on this show, he's organised TCCA UK, which is a massive platform for being able to allow the community to develop, to look at new options to be able to deal with stresses, to look at how the community can move forward as a community. So I think our biggest challenge will be how do we kind of look at where we're going to be in 6 months' time, and how do we equip ourselves to deal with those challenges. Who we're going to have in the next program, I was going to suggest, and I've spoken to Gulai briefly, is we have this new team, obviously, that we launched on Friday, and let's find out about what they do, and let's see how the community can tap into those services. Allow the person who's going to be in charge of communication, Gulai, to be able to explain what communication systems are going to be put into place and how they can be utilised. And if there's any other people out there who want to comment around things that we haven't considered, then please do, because the projects are adaptable. The befriending, how would we aim to allow the befriending to operate, and what type of befrienders are we seeking? The food runs of volunteers, where do we need volunteering from? So all these myriad of questions that we want to ask the community, and we want to tell the community what we're doing, is let's get those officers on board next week, let them speak to the community, let the community see who they are, and let's see how we can utilise those services that are going to be available.
Yeah, that'd be very useful. Mike, any last words before we tune out?
Well, maybe just to say one really positive thing for me is that people are working together so much better than ever before.
Yeah.
The barriers are broken down, people are talking to each other, and there's a lot of joint working, and that's been a real plus. It's necessary, but it's been a real plus, I think.
Yeah, definitely. Jansev?
Just to echo really what both Mike and Erim have said, it is really lovely to see, as Mike just said, a lot of groups and individuals coming together and working together and supporting each other through this. Let's keep doing that. And stay safe.
Anything else you'd like to add?
No, I think my colleagues are putting down to enough, and I like Jansev's ending note. Let's stay safe.
Yes, definitely. We must. In all of these, yes, it's very hard, but we do need to follow government guidelines and adhere to the restrictions so that hopefully we do come out of it as quickly as possible. Because like we've talked about, there are huge statistics out there and a lot of people in hospital. And although there's people are surviving it now, there are lots of vulnerable people out there and people of a certain age that it's fatal for. So we've got to be careful and stay safe. Thank you very much for my guests, Mike, Jansev, Erim, for coming on my program tonight. Thank you very much to our audiences and all the comments. That's it from us from Eurogench TV. Have a very good evening. Good night.
Thank you.
Biliyor musun? Erken rezervasyon başladı. Yazın en renkli fırsatları cyprusparadise.com'da. %40, %50 hatta %60'a varan kaçırılmaz indirimler. Erken rezervasyon yap, uçak bileti fiyatına paket tatili al. Uygun fiyata Kıbrıs tatilinin adresi cyprusparadise.com. Zaman akıp gitmeden acele edin. Bir bakmışsınız yaz gelmiş. Cyprus Paradise. Tatiliniz bizimle güvende.
Kalitenin, güvenin, hızlı teslimatın adresi Ancon Furniture. Ancon Furniture ailesi olarak yeni ürünler ile hizmete devam etmekteyiz. Yeni model koltuk takımlarımız, yatak mekanizmaları bir dokunuş ile açılıp bir dokunuş ile kapanabilmektedir. Bir dokunuş ile açtığımız yatak mekanizmasının yatak çarşafı kullanıma hazır, serili olarak içinden çıkmaktadır. Yıl sonuna kadar herhangi bir koltuk takımı alan her müşterimize akıllı sehpa hediyemizdir. En iyi ürün, en iyi fiyat. Sadece Ancon Furniture'da. Bize uğramadan karar vermeyin. En iyisini biz yapana kadar daha iyisi yok.